Now let's look at a range of diseases in which the anemia is associated with red cells of a normal size, normocytic anemia. One of the most common that we see in hospitals now is the anemia of chronic disease, the anemia of chronic inflammation. This is a very interesting background. Whenever there is chronic inflammation or infection within our body, the body sequesters iron within macrophages. It starts to shut down the flow of iron within the body. Now, this leads to a reduced iron level in the blood and a reduction in hemopoiesis. Now, you might ask, why on earth does the body do this? Well, it's almost certainly a physiological, evolutionarily selected mechanism to limit the amount of iron available for pathogens like bacteria. Iron helps bacteria to divide, and here is a mechanism of hiding it away from bacteria. There are two pictures on the right showing examples of how this may happen. At the top, we have a patient with rheumatoid arthritis, and chronic disorders such as that are often associated with some form of mild anemia. And at the bottom, you'll see a bone marrow stain for iron, and the blue there represents the iron which is present within the reticuloendothelial cells. It's been taken in because of anemia of chronic disease. It's quite a nice illustration of how iron really has to be very carefully regulated within our body. Now, the treatment of anemia of chronic disease is really to treat the underlying condition. Treat the rheumatoid arthritis, or perhaps the malignant disease, or whatever it may be that's leading to this condition. And then the rest of the anemia will sort itself out. Another important cause of a normocytic anemia is renal disease, because remember that the kidney produces erythropoietin, the major regulator of erythropoiesis. You'll see on the right a chart showing this very beautiful feedback mechanism for regulating erythropoiesis. In the bottom in green, the kidney acting as an oxygen sensor and producing erythropoietin whenever there is hypoxia, releasing that, which leads to increased erythropoiesis and a correction in the red cell mass. If the kidney is damaged, it may not be able to make erythropoietin, and anemia used to be a very severe problem in patients with chronic kidney disease. Now, fortunately, we know a lot about erythropoietin now, and it's being cloned and can be produced as a molecule for injection, and it's widely used for patients with chronic renal failure and helps to increase their hemoglobin. Another time where you may see a normocytic anemia is when the bone marrow itself is involved through other diseases. Now, in this situation, you'd also see reduction in white cells and platelets. The bone marrow simply can't produce enough normal cells. This can be due to a wide range of clinical problems. I've listed some there: infiltration with leukemia, myeloproliferative disease, infiltration with carcinoma, or aplastic anemia. On the right, you'll see a trophine biopsy of a bone marrow, and I don't know if you can recognize yourself, this is a difficult slide, of what that may be, but in fact that pink tissue is metastatic carcinoma, and that was leading to anemia in this patient. Let's now turn to macrocytic anemia, where you have large red cells. The major cause here is a disorder called megaloblastic anemia. Quite a long word again, but we can easily understand it. Megalo, large, blast, the primitive erythroblasts. Look at the right-hand side and you'll see those very large purple erythroblasts within the bone marrow. Why are they large? Well, essentially, the vitamin deficiency here is limiting their ability to divide and replicate. So they're trying to expand and produce more molecules ready for division, but they simply don't make the final division. This is due to deficiency of vitamin B12 or folate. A characteristic feature within the blood film is shown at the bottom, and you'll see two white cells, which you'll recognize as neutrophils. Now, neutrophils have lobed nuclei, multi-lobed nuclei, and you will see there more lobes than you would expect, normally up to 5, but in this condition you can see more than that. It's a characteristic feature of megaloblastic anemia.
You just completed your first video of the world's best medical exam preparation. Lecturio brings the knowledge of worldwide leading medical experts and teaching award winners to your PC, tablet, or smartphone. Prepare yourself and check your progress with thousands of quiz questions, customized to USMLE standards. And the very best, you can get in touch with our medical experts personally. Visit lecturio.com now and continue with the most inspiring medical education around the globe, anytime, anywhere.